Learning channel. Today we'll be talking about introduction to respiratory system. We'll make it very real quick. It's just an introduction to the respiratory system of the human body. So in the respiratory system, we have the nasal cavity, the nose, the trachea, the bronchioles, the alveoli, the larynx. Okay, so let's move on. Introduction to the respiratory system. So in the respiratory system, we can say that the respiratory system is a complex network of organs and tissue that work together to enable breathing and gas exchange in human body. So as you can see here, you can see at the top, that's the nose. Coming down, we have the trachea. So this is the nose. Coming down, we have the trachea. These are the lungs. This is the bronchio. Okay, this is the bronchio, the diaphragm, and then when we zoom in, we have the alveolar over here. Okay, so let's move on real quick. Okay, so we move on to the anatomy of the respiratory system. So the respiratory system consists of these four major parts. Okay, so we have the nose, the nasal cavity, the pharynx and the larynx, the trachea, the bronchi, the bronchioles, the alveoli, and then the capillaries. So let's look at the diagram here. So when we look at the diagram here, let me clean everything so we can see. So starting here is the nose, that is the outer part, okay, and the nasal cavity is the inner part of the respiratory system, and then coming down, we say we have the larynx, okay, so we have the pharynx and the larynx. Okay, so now let's look at it. We have the pharynx and the larynx, or the voice box, okay, which is having the vocal cords, and then which makes us to speak. Okay, and then coming down here, we have the the trachea, the bronchi, and the bronchioles. So let's look at the trachea. The trachea is this, okay, and the bronchioles, and then the bronchi, and the bronchioles are the branched ones, okay. And on the branched ones, we have some things here that you can see. It's called the alveoli. When they are like sac-like structures, okay. So when we zoom in, we see them here. That's it. When we zoom in, we see them here as sac-like structures, okay. Now let's move on. So we have the alveoli and the capillaries. I've talked about it, okay. So this is the anatomy of the respiratory system. So the nose and the nasal cavity takes in the air, which is called inhalation, or somebody will say inhaling, okay. And the nose and the nasal cavity is there to filter and warm and then humidify the incoming air before it reaches the lungs, because some of the air are having pathogens and then harmful substances which are not good for the body, okay. And then we have the larynx and then the pharynx, which is responsible for speech, or let me say voice, okay. It allows us to speak. And we have the trachea, the bronchi, and the bronchioles. The trachea, or the bronchi, they carry the air from the nasal cavity. They are connected to the nasal cavity, coming down to the lungs. So they carry air from the larynx. Okay, they carry the air from the larynx to the lungs. Okay, the trachea carry the air from the larynx to the lungs, and then the bronchi further carries the air through the lungs, okay. And then the bronchi are further divided into branches, which is called the bronchioles in the lungs, and the bronchioles are having sac-like structures, which are called the alveoli, okay, the alveoli, and then they have capillaries. So the alveoli are the tiny sacs, okay, in the lungs, where gas are exchanged. Okay, that's where oxygen diffuses, and then carbon dioxide is being brought out from the body. So that's where gas exchange occurs. So oxygen then is absorbed into the bloodstream through the thin walls of the alveoli and the capillaries. Okay, so we move on real quick. So we've talked about the nose and the nasal cavity. So for deeper understanding, we can look at this. We say the nasal cavity is divided into two halves by the nasal septum. So what we see here is called the nasal septum. So these nasal cavities are divided by what? The nasal septum. That's here. There's a bone, inner bone there, okay? So which is dividing it, and is lined with a mucous membrane called the nasal mucosa. So the nasal cavities are lined with a mucous membrane called nasal mucosa. And the nasal cavity again contains turbinates. I want to talk about turbinates. The turbinates are responsible for um, increasing surface area to trap dust, bacteria, and other particles in the air that are passing through the nose. Okay, so I'll show you a diagram of the turbinates when we move on. Real quick. Okay, there's it. This is a diagram of it. So let's look at it. So we can see this the turbinates. What you can see here. This one of the turbinates. This another one. This another one. This another one. Okay. This another one. Those are the turbinates. So we have the middle turbinate, the superior turbinate, and the inferior turbinate. They are responsible for filtering out dust, bacteria, and other things from the air that are passing through the nose. Okay, and we have the maxillary sinus and the ethmoid sinus. So we are not talking about that for now. So we can see the nasal cavity is the inner part of the respiratory system. That's starting of the respiratory system, and this is the nose. Okay, the nose is the outer one that we can see here. The nasal cavity is the inner one. Okay, so what we see here is the nasal septum. Okay, here, which divides the nostrils. That's the nasal septum. Okay, yeah, the nasal septum. Now let's move on. You can see the larynx here, or the voice box. Okay, and okay, that's it. I think so. So let's move on. Let's move on. Now let's talk about the pharynx and the larynx. Okay, the pharynx is a funnel-shaped muscular tube that connects the nasal cavity and the mouth to the larynx. So it connects the nasal cavity and the mouth to the larynx. So what we are seeing here is the pharynx. Here is the pharynx, which is connecting here the nasal cavity and the mouth cavity, or the oral cavity, to the larynx over here. Have you seen it? Yes. So that's it. Now let's look at it. The pharynx can also be subdivided. Okay, the larynx, or the pharynx, sorry, the pharynx can be subdivided into three, which we call the nasopharynx, the oropharynx, and then we have the laryngopharynx. Okay, here. So you can see it's divided into three regions or subdivisions. We have the nasopharynx, the oropharynx, and then the laryngopharynx. So the nasopharynx meaning the nasal cavity, and then the pharynx meeting together, forming the narrow pharynx. And we have the oropharynx meaning the oral cavity, and then the pharynx meeting together to form the oropharynx. And we have the laryngopharynx meaning the larynx, and then the pharynx meeting together at this point to form the laryngopharynx. I hope we understand it at this point. Okay, so let's move on. Let me erase them. Okay, so let's move on. So the larynx contains epiglottis. Okay, the larynx contains what we call epiglottis, and the epiglottis prevents food from entering the airway during swallowing. So you could see that there are two airways here. Let me show you. there's one down here, and this is another one here. So can you imagine when we are swallowing something, it can either go here or go here. So the larynx here has something here which we call the epiglottis, which prevents food from entering the airway or the air passage, okay, which is called um, the trachea, okay, yes. So when we swallow, it comes directly here. It's not supposed to come here, okay. So this thing here prevents food from entering the trachea. Yeah, that's what it means. So the epiglottis prevents food from entering the airway or the trachea. Now let's move on. I think we are good over there. Okay, so this is this is a very huge picture of the trachea. So the trachea is a cartilaginous tube, okay, which can be subdivided into many. We can divide it into many divisions, okay, into smaller divisions. We have the bronchioles, we have the bronchi, we have the larynx. Okay, so let's look at the divisions. Okay, so let's bring it forward a little bit. Sorry, let's bring it forward a little bit. Okay, I hope you can see my screen. Okay, here. So you can see the hyoid bone, over here. This is the hyoid bone over here, and this is the thyroid cartilage, okay, and we have the thyroid membrane here. This is the thyroid membrane. We have the thyroid cartilage, and this is a cricoid cartilage, and here we have the um, thyrocricoid or cricothyroid membrane. Okay, it depends on. Sometimes I really um, use how I understand it to remember. Okay, so it's called the cricothyroid membrane, and this whole thing is called the trachea. Okay, yeah, that whole thing is called the trachea. Let's erase it and let's see. The whole thing is called it. Now let's look at the um, latter part. Okay, the latter part, we are having some branches. Okay, so let's look at the branches. These branches are called the bronchiole. Okay, so we have the bronchus, the left bronchus, the right bronchus. Okay, so these branches are leading into the lungs. Okay, to form some other branches also. Okay, so let's look at something here. The trachea is a cartilaginous tube that extends from the larynx to the lungs and is lined with ciliated epithelium and mucus secreting glands to trap and expel inhaled particles. Okay, so it has something which we call the ciliated epithelium and the mucus secreting glands. They secrete the mucus to trap dust and other things that are associated with the air we breathe. Okay, that's why you see when we bring out mucus, there's some are having dirt in there. Okay, it's because the air you inhaled are having particles which are not good for the lungs, so it traps those things to bring them out. Are you good? Okay, the trachea branches into right and left main bronchi. Okay, I've talked about it, which enters into the lungs. I've talked about it. Okay, so without wasting much time, let's move on. Let's move on. Okay. Okay, so now we are coming to talk about the alveoli and the capillaries. Okay, so this is the alveoli we are seeing here. I said it earlier in our video. So the branched bronchus has alveoli on them. Okay, so the alveoli are the tiny sacs located at the end of the bronchioles. Okay, the bronchioles are the branched aspect of the um, trachea. Okay, so these branched aspects are having the what we call the alveoli. They are sac-like located at the end of the bronchioles. and they are thin walled, so it allows them to diffuse air into the lungs, which is then carried into the blood, okay, for us to have oxygen, okay, in our blood, which is called oxygenated blood, okay, and it exchanges oxygen and carbon dioxide between the air and the bloodstream. And let's look at the capillaries. The capillaries are also associated with the bronchioles. They go along with the bronchioles, or they are penetrating into the bronchioles. Okay, so the capillaries surrounding the not bronchioles, alveoli. Okay, the alveoli, not bronchiole, the alveoli are a dense network of capillaries. Okay, the smallest blood vessels in the body. Yeah, they are the smallest blood vessels in the body. And oxygen from the alveoli diffuses into these capillaries to capillary blood, okay, while carbon dioxide from the blood diffuses into the alveoli to be expelled from the body. Wow, very interesting. So the air we take in comes into the lungs through this, okay. So it is in the alveoli that gaseous exchange occurs, where the capillaries take the oxygen, okay, from the alveoli into the bloodstream, and then the carbon dioxide is left in the alveoli to be what expelled from the body. Very interesting. Now let's move on. We'll be talking about mechanism of breathing. Okay, so we have inhalation, exhalation, and respiratory muscles. Okay, so now let's talk about the inhalation. During inhalation, the diaphragm muscle contracts. Okay, during inhalation, the diaphragm muscle contracts, causing the chest cavity to expand. Okay, causing the chest cavity to expand. So we can see here, um, during inhalation, it contracts up like this. Okay, causing the chest cavity to what to 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 expand, and this expansion lowers the air pressure inside the lungs, allowing air to what to be drawn in through the nostrils. Okay, so it comes, it contracts, okay, and air comes into it. Now let's look at exhalation. In exhalation, the diaphragm relaxes. Okay, the diaphragm relaxes. The diaphragm relaxes. So I've done this to show you the position where it expands and relaxes. So it relaxes to increase the air pressure inside the lungs, forcing air out through the nose. Okay, forcing air out through the nose. So this is basically how um, respiration occurs. And we have respiratory muscles. There is the intercostal muscles between the ribs, also plays a role in breathing by contracting and relaxing to change the volume of the chest cavity. Okay, so that means it's not only the diaphragm muscle that helps in respiration, that's inhalation and exhalation. So we have the intercostal muscles to playing a very big role in it. That's they play a role in breathing by contracting and relaxing to change the volume of the chest cavity, so that we can be able to exchange gas very well and efficiently. Okay, so let's move on. So now we're talking about respiratory volumes and capacities. Okay, capacities. So in inhalation and exhalation, we have different volumes and capacities. So we have the tidal volume, the expiratory capacity, the vital capacity, the residual volume. So we'll talk about the tidal volume is the amount of air that you take in. Okay, is the amount of air that inhaled and exhaled during normal relaxed breathing. So as I'm sitting and relaxed, okay, and I'm not talking, I'm just relaxed, the amount of air inhaled and exhaled is called the tidal volume. Okay, it's called the tidal volume, and it's typically 500 ml. Okay, or milliliters. Okay, And we have the respiratory capacity. Respiratory capacity is the maximum amount of air that can be inhaled after a normal exhalation. So if I'm there and I just like inhale huge or maximum amount of air, is called the respiratory capacity. So I just go like this. Okay, so that's the maximum capacity, respiratory capacity, and it ranges around 3,600 ml. And we have the vital capacity. The vital capacity is the amount or maximum amount of air that can be exhaled after a maximum inhalation. Okay, so if after inhaling I try to exhale, okay, the maximum amount of inhalation or air that I expel from the body is called the vital capacity, and it ranges around 4,800 ml or milliliters. And we have the residual volume. The residual volume is the amount of air that remains in the lungs after a maximum exhalation. Okay, after a maximum exhalation, there are some amount of air that is left in the body is called the residual volume, because we cannot scientifically or normally we cannot bring out all the air from the lungs. No, it's not possible. There must be some small amount of air remaining in the lungs, and that air is called the residual volume, and it ranges about 1,200 ml or milliliters. Okay, yeah. So let's move on. We are talking about the respiratory control and regulation. Okay, so the respiratory system is controlled by a complex network of neural signals and chemical feedback loops. The brain respiratory center, located in the medulla oblongata, and then it regulates the rate and depth of breathing based on level of carbon dioxide and oxygen in the blood. Okay, and you have the chemoreceptors in the carotid arteries, and aorta monitor blood gas levels, and it sends signals to the respiratory center. Okay, when carbon dioxide levels rises or oxygen level drops, the respiratory center increases the rate and depth of breathing to restore balance. Okay, so in normal day or in a typical day we can breathe about 12 breaths per minute. Okay, that's the average resting respiratory rate in adults. Average resting respiratory rate in adults, 12 breaths per minute, and the approximate number of breaths taken by an adult per day. So per minute is 12 breaths per minute. Okay, in every minute we can take about 12 breaths, but per day we can take about 40,000 breaths per day. Okay, this is just by the way. Let's move on. Okay, so in this case we are going to talk about some respiratory diseases and disorders. Okay, there are some levels of respiratory diseases and disorders. I arrange them in a pyramid form. So the first one I'm talking about asthma. Okay, asthma is a chronic inflammation and constriction of air. Okay, of airways. So this is a very typical condition, and I think we all know about it. Asthma is very common. It's a chronic inflammation and constriction of airways, which the patient finds it difficult to breathe, and they gasp for air. Okay, and asthma, I can say, is an allergy. Okay, somebody can be allergic to a specific substance, which when he or she or the person comes in contact with it, it can lead to this condition, which the airway gets constricted and they gasp for air. Okay, and the second one we talk about chronic obstructive pulmonary disease. Okay, which is called the COPD. Okay, is progressive lung damage and air obstruction. Okay, where the lung gets damaged is a progressive. So that means it does not come at once. It's a progressive lung damage. So it has stages. Okay, it has stages in which the lung gets damaged, and we have lung cancer. Yeah, this is a very rare condition which happens to people who are chronic smokers. Okay, who are chronic smokers. They normally get a lung cancer. That's abnormal cell growth in the lungs. Abnormal cell growth in the lungs can easily damage the lungs, leading to death. Okay, yeah, and the fourth one, I'm talking about pneumonia. Okay, pneumonia is also um, a lung condition. Okay, a lung disease or respiratory disease. It's a lung infection causing inflammation and fluid buildup. It's a very dangerous condition, but curable. Yeah. And then lastly, I have sleep apnea. Okay, sleep apnea. It's an interrupted breathing during sleep. Okay, and is not very common, but it's a rare condition. It normally happens during sleep. You see that the person gasps for air or is unable to breathe or have shortened breath. Okay, is interrupted breathing during sleep. And the respiratory system can be affected by a variety of disease, as I said, and disorders, each with its own unique symptoms and impacts, from chronic conditions like asthma and COPD to acute infections like pneumonia and lung cancers. Okay, and these respiratory issues can significantly impair breathing and overall health if not treated. Okay, if not treated, it can lead to even death. So this brings us to the end of our introduction to respiratory system, and this is not the end of it. We are going to go into deeper talking about the lungs, what it does, what it's composed of, everything about it. We talk about the trachea. We are going to talk about the nose, the nasal cavity, the bronchia, each in each video. Okay, we're going to talk about deeply into it, the anatomy of it and the physiology of it. Okay, so I would like you to subscribe, like and share the video, and if you need a copy of my slides, you can email me through skapaper@gmail.com. Okay, see you next time. Bye bye.